Hi, everyone. Thanks, Chris, for the introduction. I'm Christina Fong. I'm from NINDS. NINDS and PDBP Consortium are very happy to have Dr. Nick McFarland and Mr. Phil Rose here with us today. Dr. McFarland is a professor at the University of Florida Health, where he runs the Atypical Parkinsonism Clinic at the Norman Fixel Institute. His patient, Mr. Rose, has multi-system atrophy and kindly agreed to join Dr. McFarland today to share his experiences with living with MSA and with participating in clinical research. Thank you so much for joining us today, Dr. McFarland and Mr. Rose.
Yeah, thank you so much, Christina. I really appreciate it. And I guess I want to first take a moment and thank Mr. Rose for actually doing this and putting himself out there a little bit. We're going to try to keep this a bit informal and just have a conversation. And I think what's going to happen is if you guys have additional questions, please write them in the chat for us. And we'll start the conversation together and just go along. And if you guys have chat questions, we'll try to answer those near the end of our discussion, but we'll leave time for that. So I just wanted to start basically just by saying that Mr. Rose, would you like to just tell us about yourself? I mainly want to just kind of start off really by asking you about your diagnosis. Like, how did you get your diagnosis? When did your symptoms begin? And kind of how long did it take for you to get diagnosed?
I appreciate it, Dr. McFarland. I do apologize if anyone has difficulty understanding me. Speech is one of the things that gets impacted by this illness. I basically, my name is again Phil Rose, and I spent the majority of my life in healthcare, working on various teams, various companies. But my last job was director of NIA, not to be confused with NIH, director of client analytics at NIA, which is National Imaging Associates, part of Magellan Healthcare. And so I'm very familiar with client data, and I appreciate the work that your team and others are doing with the data. It's a lot of data, as you can see from the earlier presentation. MSA is a small piece of that data. It's about 1/3% of the total volume that you guys are studying in the original presentation. So, I do understand when thank God there's time to discuss MSA. It always doesn't get discussed like it does from Parkinson's. But I was diagnosed in about 2015 with MSA after spending probably 2 years searching for a diagnosis. I had pain in my legs. I had some other issues, but hadn't really experienced a lot of the stuff I'm experiencing now. The biggest thing was the burning in the legs, and it was hard to diagnose. And again, after about 2 years and 4 doctors, one neurologist told me that I have something called Scheidegger syndrome, which is, as you know, a part of MSA, or is MSA. And I took it along from there.
Yeah, one of those older terms that we still use, but not as often anymore. Yeah, so you mentioned well, I guess the pain in your legs, but and some of your speech issues. Can you just tell everybody kind of what are some of the other kind of symptoms you have experienced?
Yeah, over the years, I've experienced issues with sleep. I've experienced issues with my handwriting, my typing. My handwriting is completely illegible, unfortunately. I've had issues that have now migrated to typing. I have issues, unfortunately, with ED. I have issues with my bladder. Probably the most significant issues are with my coordination and my balance. I fall pretty much weekly, unfortunately. So I have to be very careful when I move around, especially in situations where I may be backing up. And then I probably struggle. The most difficult thing is I deal with orthostatic hypotension. So it's tough to medicate with the low blood pressure when I also deal with high blood pressure. So I know that the orthostatic hypotension has probably caused me to lose my consciousness 1 or 2 times. And again, it's tough. It's tough to medicate as well when you're dealing with high blood pressure.
Yeah, that's a lot of symptoms. It's a complicated disease. So indeed, let me ask you just a quick question. So it comes in, I like to talk, it comes in a couple different faces, Let me ask you, in your particular case, we've talked about Parkinson's, or we call cerebellar symptoms. What do you have any Parkinson's besides your balance issues, like stiffness, slowness?
Yeah, I'm dealing with some of the rigidness, some of the stiffness in my limbs, which I deal with in Parkinson's. The tremors are like you constantly see with Parkinson's. They do come, few and far between though with MSA. The shaking and tremors are not a common theme, as in the balance and the coordination is much worse than you would have when they're dealing with Parkinson's.
Yeah, I don't, this is probably a really tough question. If you had to say what's your number one thing that bothers you the most, could you say that, or?
Yeah, probably. I mean, the bladder issues aren't fun, but I probably had the most difficulty dealing with the orthostatic hypotension.
Yeah,
that's probably the most difficult thing because it's not really controllable. I do try to control it with the midodrine. Taking that seemed to help, but the low blood pressure is definitely something that's a struggle.
Yeah. Well, tell us how would you describe this disease? How does it impact you kind of on your daily life,
Yeah, I mean, I'd say significantly the most issues I would have, obviously my speech. It's tough for my wife, my daughter, and others to understand me all the time. The balance issues are definitely a significant issue. And again, not to belabor the thought, but the orthostatic hypotension is probably the most significant part of this disease. It's hard to get control of.
Yeah, how much activity are you able to do these days?
Not much. I basically, unfortunately, have discovered internet TV and the uses for finding things, but I'm not able to. I'm able to drive. I'm okay in the car for now, but I don't do a lot. I can't even go to something as simple as Publix because the low blood pressure can hit at any time.
Yeah, well, one of the things we've always talked about and afraid about is fainting, or we call that syncope. I don't believe you've had any of those spells lately.
Not lately, which is good. I have fainted twice before, but thank God with the medication, hopefully, and being careful and staying indoors a lot, I haven't had other issues. And usually I'm able to manage those issues when I'm sitting down and reclining. So I try to stay indoors as much as possible.
Yeah, so it really limits a lot of things you can do.
Right.
Can you mention a little bit more about the sleep issues you're having?
Yeah, they started with acting out. I'd say almost like sleepwalking without sleepwalking. But I'd be in bed and moving my arms and getting rather violent. And those went away. That's the initial sign something's not right. And now I have a CPAP which seems to help with the snoring and the noises I make. But it's definitely there was a time there when the noises were rather loud. The CPAP is definitely manage some of those noises. I don't have the dreams or acting out anymore that I used to, which is good. But I still make noise if I fall asleep without CPAP. Sounds like a train is coming. But the CPAP seems to manage that, which is good.
That's great. I think you've almost hit on every symptom of MSA so far, unfortunately.
Unfortunately.
Yeah. But it really sounds like it has really significantly affected you. I think for this session, we want to talk a little bit about, research and, for us clinicians and researchers working on this and other Parkinson's disorders, sort of, I think we're interested also kind of in your opinion, kind of what are you most interested in hearing about in terms of potential new treatments or even care for MSA?
Yeah, I mean, all the above. I'm always interested in new technology, new medication, new potential clinical trials that would be coming out specific to MSA. As I talked about earlier, it's a small piece of the pie.
Yeah.
So any information that could be garnered on MSA is always a positive thing. And, my ear is always to the internet or to other places to find out as much information as possible in regards to what's happening with MSA.
Yeah, it is sort of a second cousin compared to Parkinson's disease and does not quite get the same amount of attention as that disease
Correct.
does.
Correct.
Well, so what would you like us, scientists, clinicians to be working on, in addition to the research we're doing already at the PDMP? Is there anything specific you'd like us to do or to focus on as a patient?
I mean, the biggest thing is communication. That I think is lacking when it comes to MSA, unfortunately. It does get talked about, usually in unison with a larger, Parkinson's discussion. More information and more advances in how that information could be communicated. When we're dealing with something, unfortunately, as significant as MSA, and all the information that can be potentially provided, get it out there.
Yeah, I know you're interested in a new treatment or cure, but I think that maybe it sounds like, do you think us clinicians or scientists are educated enough about this disease and aware of it enough? Or
I don't think there's enough awareness potentially with MSA. When I was in the hospital in 2019, in April, I was in a hospital and the doctors unfortunately had not heard of MSA. Obviously, neurologists have heard of MSA, but just in general, it's something that is so rare. It's not something that's communicated a lot. So there's not a lot of familiarity with the disease. So that's definitely something that could be improved when it comes. I don't know if MSA is growing. Hopefully it's not, but if it is, it could be something that's more prevalent in the future. This requires another, a little more communication.
yeah, so we make it more of a priority. Well, so make it maybe more of a focus, well, tell me about sort of research. We have you now participating in a trial, and I wanted to ask you kind of what, what drew you to participating in research, besides us talking to you about it? But
yeah, no, it was something that I actually found it on the internet, that there was a clinical trial happening with Biohaven and verdiperstat is the drug. That clinical trial was happening. I happened to go to University of Florida back in the day, so it was one of the choices. Unfortunately, it's about 200 miles away. So I discussed it with my neurologist, who is actually at University of Miami. So it was one of the times when you get a hurricane would go ahead and advise someone to go to Gainesville. Not very common.
It's all right. We'll just go say once a gator, always a gator. Okay.
Yeah, once a gator, always a gator. So I took the advice from a hurricane. I went to Gainesville to see the gators, and it was something that I started participating in about 2 years ago. Yeah.
So research is, as you kind of know now, maybe didn't know before, but you're a pretty educated guy, but did you have any hesitations about doing a trial?
Yeah, the biggest thing was probably due, to the lack of knowledge in regards to side effects. I guess that's probably with any clinical trial. You're not sure how bad the side effects were going to be. There didn't seem to be any with this particular trial, but you never know. The other hesitation was you want to be on the drug. You don't know if you're going to get the placebo or not. So that's something that in most trials you're dealing with. You want to get the drug, but you may get the placebo. So you're hoping to help out the community, but you may not help yourself.
Yeah. So I think one neat thing was this was actually, I would call it interventional. It's a drug trial, but if we had proposed you to be part of a observational trial, how would you have felt about that? Or would you have any other questions about it?
Still, you're looking to help out the masses, and you're still potentially gonna go out doing something, and you may not be able to help your current situation, but you may be help others. So still be something that would be considered, but you obviously want to get better at the end of the day, or at least slow down the progress of the illness, if that's possible.
Yeah.
But it's still be something that I would consider.
Yeah, let me ask you this. Do you think we would have to, as physicians or, scientists, do you think we need to do a little bit more convincing to get someone like you who has MSA, a rare disease, to be part of something that didn't have a cure, but wasn't more observation? It would take a little bit more convincing than?
Yeah, probably. You may not get a whole bunch of people to sign up, but
yeah. What do you think would help you, or help convince you to take part of a trial like that? Maybe something like imaging, sort of like a biomarker kind of study where we do imaging and take blood, or even, take other kinds of tissues.
Yeah, I mean, if that information could be used for something else, and you could be provided personal feedback along the way, that would help. I mean, you're getting blood work, you're getting observed, you're getting tested, just to have knowledge to the results of an understanding of the results would help. And again, it involves helping other people versus helping yourself.
Yeah.
You just gotta weigh, you gotta factor that in to what you're doing.
Yeah. I think as a physician, and scientists, we're always sort of struggling. It's one of those questions we struggle with. We may not talk about it as much, but we want to offer patients like you with rare diseases, which, the next best thing and a cure. But we know in the back that we still don't know a lot about these diseases, and doing observational studies are sometimes really critical. But getting your perspective on that and how to get people more involved in that is really important to us.
Yeah, I mean, you never know if that's going to be the observation that leads to a cure, or leads to slowing down the progression of the disease.
Great point.
You can take advantage of that.
Hey, did you involve anyone else in your decision to, take part in our study?
Just my wife, and she was, she's actually my caregiver at the time, so she remains that. So she obviously had a large say, and my doctor at Miami, he recommended that it's something that I should do, so I went for it.
How did, I just want to ask you how the conversation went down when you told her you're going to have to make travel up to Gainesville several times and
Yeah, and
frequently for visits.
And she's come each time. She's been able to make each of her trips. So it was something that was definitely going to be, potentially hard, but necessary to do at the time.
Yeah. What do you think's been the hardest or most challenging thing about being in a trial?
Probably the unknown. That we still don't have the results from the initial trial. I'm currently active on the drug. I've gone through my part for the 2 years and been on the drug for another year. But the unknown is definitely, the timing of the results is definitely probably the biggest thing, that we struggle with.
Yeah. And on the flip side, so what do you enjoy most about the trial or coming for visits and all?
I think that, I'm able to get updated on how I'm doing and how I'm progressing on unfortunately lack of progressing. It's my personal, basically personal advancement or decline, in knowing that information is updated each time I'm able to go into the office. And it's a trip, try to make a good time of it, and it's something different. And for me, it's a trip. It's not a trip for everyone, but it is a trip for me. So just take advantage of it.
You don't mind the poking and prodding, or
no, I mean, no one loves to get blood work done. I mean, that's a necessary evil, but you got to go ahead and go through it. They've been very good at making that work. So
I did want to ask you one quick question. I think just because I know some of the other studies the Parkinson's biomarker program does. For this study, we weren't doing what are called spinal taps, but I don't know what your I want to put you on the spot for a second. What's your opinion? How can we, so these we call lumbar punctures formally, but sticking a needle in the back is not something that most of our patients want. But if we'd asked about it, do you have any thoughts about that?
Yeah, it's not something that I initially signed up for, but I think if, it wasn't something that was necessary, but if it was just, discussed differently to improve the process, or the findings could help, improve where I'm standing, something I would consider. Lumbar puncture isn't something I would necessarily sign up for, but if there was a benefit involved at the end, it's something I would consider.
Okay, that's good to hear. Not everyone thinks that, but that's good to hear, though. Let me ask you if obviously that's not a recruitment thing, but are there any other things that we can do to help kind of recruit more participants just like you? You're a great participant.
Now, I mean, the biggest thing is you have to communicate the trial information. They're not, unless you're specifically looking out there, word of mouth is always a good thing. When you hear about something, communication to your patients. I found the information on the trial that I'm in today, and I discussed with my neurologist at Miami, and he thought it was a good idea, but it would be nice if he was able to bring it up to me instead of me bringing it to him.
Yeah. Are there any particular websites you went to learn about this trial?
No, it's just when you typed in MSA, you saw that Biohaven was doing the research.
Mhm.
And then when you navigated through, you found the trial website and saw when and who was participating. So it was just, you went out there and found it.
Yeah. So there are some sites, I don't know, I don't recall if you actually looked at what was called clinicaltrials.gov, which is
Yeah, that's where I ultimately found it.
that's good to hear. So did you have any trouble navigating the site?
No, the site was pretty easy to navigate. It was pretty clear. Once I got there,
Mhm.
found the information, it was easy to navigate through. It was just, finding out about a trial. If you don't do your own research, you're not going to get the necessary information that's out
Yeah.
there.
All right, so I wanted to ask you a couple other questions. I'm going to look at the chat too here, but one question I had really was, so we don't have the final data, but would returning you some results like preliminary findings, even though the findings might not be 100%, okay? They're just preliminary findings, would that sort of incentivize or discourage you from participating?
I think for me personally, I think it incentivizes you. If the data is coming from a reliable source that you trust, and you could get preliminary findings, you don't want to get a whole bunch of information out there from people that aren't credible. But if it's if it's from your doctor and it's from your study, and even though it's preliminary, it's something that they believe in, and they do a good job of selling that information. I think that it's worth having.
Yeah, as long as it was sort of couched properly.
Exactly.
Okay. Let me ask it. So one last for me, I think, is there anything you wish you knew before you enrolled in these studies? I mean, something you'd like to know ahead of time that you didn't think about?
I mean, the biggest thing is of course, I would love to know if I was on the trial drug or not, if I was on the placebo versus not. And that's ultimately the first thing. But I think you did a good job communicating as I've gone through the process. And so I've had the information that I feel that I could be able to get ongoing and throughout this entire process. So that's definitely
let me one
been a
last thing I want to
positive.
one last thing. I didn't mean to interrupt. We'll just they have a question about another procedure, and I'm going to finish with one other question. One of the investigators asked, we talked about spinal taps. One of the new procedures for Parkinson's and even MSA is what's called a skin biopsy. Have you heard of that?
No, I haven't.
It's about a 3 millimeter kind of hole punch in the skin, done under a little bit of local. How would you feel about that?
If it's something that's not an invasive procedure, it's not something I'd be adverse to.
Yeah, it's partially invasive because it's getting a little skin, but it's just a biopsy of the skin. So it is a little bit invasive.
Yeah. Is a local anesthetic?
Yes.
Yeah, I mean, if it's just local, then it may not be too bad. It's something I probably would do more research on and have to make my decision accordingly. Looking at the data as it comes. But it's another option which today you don't have.
Yeah, it's a new
This is
potentially a new diagnostic procedure for these diseases that we may hear more and more about as we go ahead. So it's good to hear you might be willing to that, but there's some questions, it sounds like.
Yep.
Anything, we're going to run out of time. I want to give you one last second to tell us anything else you'd like to tell to the community here, scientists, clinicians, coordinators about taking part in trials, and any message you want to give to us about how to treat patients and participants.
No, I think, you've done a good job, with me personally. In general, MSA is obviously, as you know and others know, it's a pretty bad diagnosis. Today I use a walker. Unfortunately, I think I'm too young for a walker. So the fact is this is impacting someone that's 50 is scary. So I would just say continue to focus on the disease. Try to carve out as much time as possible when it comes to MSA versus Parkinson's, because a lot of times they get confused for one another. So if there's the ability to discuss MSA as much as possible, that would be great.
Well, thank you so much for answering all these questions. Some personal. Really appreciate the time you've taken today and given us kind of your perspective on this. I think it's really valuable.
Okay.
Thanks again.
Thank you so much, Dr. McFarland. Thank you so much, Mr. Rose, for sharing your experience.